Hi, what happened to that guy? He got old. I don't know how it happened, but it did. I'm much gladder now, though. I have much more wisdom than I did back then. Um, I'm filming now hiking, and I wouldn't be hiking, but I think it's a much more comfortable place for me to be speaking. I initially set up this video, and I was at a desk with a script, and I was dressed properly and nice background, and it felt so forced and seemed so forced. I just hated it. So I thought, I'd rather come to a setting I'm comfortable with and do my best to pretend this camera in front of me is a good friend, and I'm just kind of giving you the lowdown about nursing homes. As you saw from my maybe that description, I had been working in nursing home administration 5 years, taking different jobs, and then I worked as a state nursing home inspector for another 23 years. Most of that I was doing complaint investigations. And so it's really given me a good insight, into nursing homes and what goes on there. And I just want to kind of have a venue to tell it like it is, like I'm just talking to a friend. And I'm just going to talk off the top of my head. I might miss a point here and there, but I think it's going to be a lot better if I just kind of go over subjects and just speak from what I know. It'll be a lot more natural and seem better to watch, I would think, instead of being so forced. The good thing about where I'm at now, I just retired last year in 2025. So I don't have to be responding to anybody, no supervisor, no company, no state. I can kind of just tell things like they are, So for so many years, I had to just kind of zip my lips and be quiet and not give recommendations. And so now it's very liberating to do otherwise, I can really speak my mind and tell it like it is. So that's great. And, I have a lot of ideas. I I want to share. I wrote 2 books even, one for administrators with a lot of ideas that I think can really help improve care in nursing homes, and another one for families, all the things that I couldn't tell them when they would ask, and wish I could have been able to say. So, this is my attempt, I guess, just to get that information out there, hoping people will try to learn more. Hopefully you can benefit from this. And kind of like my sister says, just sometimes you just got to put things out there in the universe and see what happens and go on, because this is the best time to share this information, and hopefully it will affect some lives and make some positive improvements to some people's lives. That's what at least I hope. All right. So if you're watching this, you probably have a loved one that is getting close or is needing or is already in a nursing home, or you may be considering it for yourself. So I just want to give kind of an initial lowdown here. A lot of people, I don't know what your opinion is of nursing homes, but most people have a pretty negative viewpoint about them. You'll watch the news and you'll see, these terrible videos of nurse aides beating on and abusing a resident. And that's pretty rare. The sad fact is most abusive elderly happens because of their family. The family may be abusing them at home, keeping them at home, doing that sort of thing. So I think nursing homes get too much of a bad rap for that. Not that it can't happen, but because that's all you only see about them. Sometimes you get that perception that's what they are, all of what they are. I think a more realistic concern that I have, and that you're probably going to have to face if you go in a nursing home, is the issue of sufficient staffing, particularly nursing staffing. I mean, it's never been great. You know, when I started in the 80s, I mean, the first seminar we had was talking about turnover of staff, and it's always been kind of a problem. And then when COVID came, it was just horrific. You know, I knew a administrator who had to work 6 months in the kitchen making breakfast, lunch, and dinner just because she could never find a cook. People were so afraid to work in nursing homes, you know, just to find a cook who wasn't necessarily going to be interacting with residents all that much, providing direct care. Since then, it's gotten a lot better. I still don't know if the staffing is as good as it was prior to COVID. I suspect it isn't. It didn't seem like it was when I left last year. And that can be a real problem for you and for me. I mean, when I think of going to nursing homes, I guess what gets me most is the expense. You know, and I'm a bit of a saver. So what I've saved and been able to retire on, it's come to me, you know, not easy. And most homes now are running into the 6 figures a year. So you might be paying anywhere from $8,000 to $9,000 a month just to be cared for. And I would be really upset sitting in my bed in my waist, not being able to have my call light answered, and just thinking how much I'm paying for that. So, you know, I don't want to be too negative, but that's a little bit how I feel. But there are going to be times where you're definitely going to just have to need it. There's no other way around it. I mean, when I say nursing home, I'm hoping most people think about, you know, the skilled nursing facility or the nursing facility that I'm envisioning is, you know, where frail people need lots of care, daily care needs. And you have licensed nurses and licensed therapists doing what's called skilled care. So they could be doing wound treatments or IVs or physical therapy, anything like that. There's also another category to consider. Most states will call them assisted living facilities. They're places more where, you know, they have a small bedroom that you can share, or it's like a little studio or a 1-bedroom apartment. You could live in it that way. And they'll provide your meals, they'll get you your medications, clean your room, and they might even help you get up in the morning, or might even help you bathe, but minimal type stuff. And then usually those homes, a lot of states have these rules because they don't have as much staffing, because they don't need it, because the care needs aren't as great. There's sort of this criteria that if you can't get out in an emergency, like if there was a fire, they'll do a fire drill. And if you aren't physically or mentally able to negotiate your way out, they'll have to transfer you out. Or a lot of times the care needs just get so great that, you know, it's obvious you need to go to a traditional skilled nursing facility and they'll transfer you. The problems with assisted living is it's expensive, and, you know, depending on how big of a room you get or where you go, it can be really high. And most of those services they provide, I mean, you could do that at your own home. You can order out food from any number of restaurants. You don't always have to depend upon that one kitchen like you would at a assisted living. And you can get groceries, you can get housekeeping services. You might even be able to get somebody to come in and help you out with bathing or things like that occasionally. And, you know, if you're in a big home and you're tired of taking care of that home, or, you know, and you got a lawn and all these things, and then your house, things break and you got to work on that, that might be a possibility. You know, if you have the finances for it, why not? Same as if, you know, your spouse, you don't have a spouse, and you don't have any kids in the area, and you don't have any real social connections, you feel kind of lonely and isolated where you're at in your home. That's another reason why. Maybe you want to go in that group setting, have meals with other people, do activities. That's perfectly legitimate and valid. to want to go into assisted living for those reasons. But everybody has to make their own decision about that. For myself, I'm a stubborn, independent cheapskate, I guess. And I want to do my best to stay out of nursing homes of any kind for as long as I can. But there's some realistic limitations to that too that I know about. You know, you can go along and do as best as you can to take care of your health, but you still might have something happen like a stroke, or you could fall and break a hip, and that's pretty much a game changer. You're going to have to go to a skilled facility at that point. You don't have any choice about it. Something dramatic happens like that, and that's going to make your decision. If you're older and kind of in that boat where something like that might happen, I encourage you strongly to, try to choose a nursing home now. Because, if you get in a situation like that and you're at a hospital, they're going to say, well, we're going to have you go to this nursing home, or we're going to try to get you transferred in a home. And, you want to be able to say, I want to go to that home. I want to go to this home. Don't leave it up to the hospital to decide for you, because, you have to get the best place that you know is right for you. And in the next video, I'm going to talk about choosing nursing homes and give you some ideas on how to do that. But try to think about that ahead of time. Have that in your back pocket in case an acute situation like that happens and you do get transferred into a nursing home after hospitalization, because that's the majority of cases for a lot of people that go in a nursing home, it seems like. All right, so that's one thing that'll get you in a nursing home, just an acute event like that. The other thing is, as we age, the probability of dementia increases with each year of life. And, it's not like you're going to be a good judge of whether or not you need nursing home care as dementia sets in, I think you probably need to have somebody in your life that can take away the car keys. If you don't have somebody like that can tell you what needs to be done and that you trust, then you have to be awfully careful being at home alone and really watch yourself in terms of your cognitive ability. I know, we get forgetful. I'm forgetful about names and stuff like that. But there comes a time where, you'll find yourself getting more and more not remembering things or leaving things on, or you have to decide for yourself, that you might be having problems mentally, and at that point, you probably need to get yourself into at least an assisted living facility. Once you're in that system, they'll move you over to a nursing facility if it's ever needed. But there's the cognitive aspect that you always have to be aware of. But, let's say you're somebody, if I was clear as a bell and never had any problems not paying bills, and I was super coherent, never noticed my life being affected by, my abilities to think, I could go on and on for a while. But there's some things I always think this is the typical game changer in terms of your physical ability, because you're going to get more weaker as time goes on. Eventually, you get really weak. But if you can maintain the ability, I always thought of it this way, there's two abilities you have to maintain. One, you have to be able to get from point A to point B in your own house. Doesn't matter how you get from point A to point B, you just have to do it. Whether it's a walker or a wheelchair, I don't care if you have to freaking crawl. I will crawl with knee pads from point A to point B if I have to. I'm not proud. I'll do that. And then number two, once you get to that point B, when that point B is the toilet, you have to get up on that toilet and be able to get up off that toilet. Plain and simple. Mobility and the ability to toilet yourself. Now, hopefully your toilet, you can elevate the seat and get those grab rails on that. It makes it easier. But those are two things you have to do. But once you can't do that, it's going to be too difficult to get staff to come in your house. I mean, trying to get staff 24/7, it's almost impossible. Nursing homes have a hard enough time doing it. For one individual to do that, it's a bit of a fantasy. And if you just think to yourself, well, I'll just have them come in maybe once a day for 8 hours. Well, you know, you don't want to be sitting in poo for 16 hours. That's terrible, and it'll just do a number on your skin. You won't be able to deal with that. I think that's about all I need to say on this video so far. My next video, I'm going to talk about things you can do to choose a nursing home, mostly off-site, things you could do right away that'll help you figure out the best place to choose. I mean, like I said, if you're there's a possibility you could ever have a stroke or something like that, emergency. You know, if you're at that age, it's definitely worth having some area selected close to your house that you can go to. And if you want to learn more, there is a website called nursinghomeRisk.com. That's nursinghomeRisk.com. You can go there and learn a little bit more. I have the book that I wrote there. Would you do me a favor? And if you like this video or found it helpful, could you do a like on it and maybe even a follow, or share it with people? Even better, if you know people that might be at that age, or they have somebody that they have in their life that may need nursing care, share it with them. I'd like to, like I said, I think I got some really good ideas, but trying to get those out there, it's almost impossible, you know. So if you could help me with that, I really appreciate it. All right, see you next video.